Hi, I'm Ashley Skorvanik, and I'm going to demonstrate how to give medications. So I would walk in, introduce myself to my patient. I would ask my patient to give me 2 identifiers, name and date of birth, and then I would confirm that. I would check the record for the documentation from the doctor saying that I needed to give the medications, and then I would explain to my patient what I would be doing. So first off, I'm gonna start with PO meds, which is by mouth. So you would take the medication out of the packaging and make sure to give it to the patient one at a time. So to ensure that they're getting their medications and they're swallowing them, making sure that they don't pocket. And if the medication is time released or enteric-coated, you cannot crush them into anything. You have to just give them the medication as is. Okay, and then next would be intradermal. So I would once again make sure that the doctor's ordered it. I would perform hand hygiene and put on clean gloves. Well, I would actually first clean the site from inside out in circular motion. Then I would draw 0.1 milliliters. Oh, and I would clean the top of this too. Inject it into the container, flip it over, and draw 0.1. And then I would hold the skin taut, make sure the bevel is facing up, go a little bit under the skin to make a bleb. And then I would put this in a sharps container without obviously recapping it. And then for insulin, you always do clear before cloudy. So for the cloudy, you roll it to make sure that the sedimentation isn't sitting at the bottom and it's shaken up. And then you would obviously clean the skin again from outside, from inside out. And then for this one, you would drop 5 units into the syringe, cleaning the top too, inserting the 5 units into the cloudy, and then 5 units into the clear. And then you would draw up the clear first. And then the 5 units of cloudy. And then hold the skin, inject it at a 90-degree angle, and then out. And then that would obviously be discarded in the sharps container. For an ampule, you would break it away from your body. If I can do it. And then you would take the filtered syringe and put it into the container. And then draw up the liquid slowly until the entire ampule has been drawn. And then you would unscrew the filtered syringe and put on the needle, obviously without it flying all over the place. You would squeeze the skin, insert it, inject the fluid, and then retract. And then for an intramuscular injection, you would take the cap off the needle, clean the surface of the bottle, put the needle in, draw up 3 milliliters, gather the skin, stick the needle in, release, inject, and then that completes meds.